Today, I want to talk to you about a complex and emotional subject, teeth extraction. As a prosthodontist, my priority is to save teeth, but sometimes performing a tooth extraction can be the better option to avoid complication. In this video, we'll discuss the signs that indicate that the tooth is damaged beyond repair and the potential complication if we decided not to remove the tooth. My name is Dr. Obeid. I'm a board-certified prosthodontist, and I practice in Chevy Chase, Maryland. So let's talk about teeth extractions and when it is time to say goodbye. When extraction is necessary, when you have advanced teeth decay, when you have advanced periodontal disease, trauma, advanced wear to grinding, external or internal resorption, failing root canals. So let's look at each one of these categories and we'll dive into it. When you have advanced tooth decay, big question is the tooth restorable? So if you have a small cavity, you can go ahead and put a filling, you can put a crown, but when the decay is so large, saving the tooth will require advanced dentistry that it may not work over time. As we advance in age, our teeth will become drier and drier, and you'll have a high susceptibility to caries, not on one tooth, on all teeth. And when the decay becomes so advanced, sometimes you have to consider taking all the teeth out and putting implants in or any type of restoration. When you have a failing root canal, that means the tooth already have a root canal that's been treated and it got infected again. That's where you say, okay, enough is enough. We've done everything we can do to save that tooth. It's probably a good idea to get the tooth out before the infections get bigger, and it will reduce the good chance of placing an implant straight forward. So that's another decision where taking the tooth out is better than trying to do too many procedures that will end up in the same place a year or two later. When you have advanced periodontal disease, what is periodontal disease? Is the loss of bone and soft tissue around the teeth. Now, if it's localized periodontal disease, you can go ahead and treat it very predictably. And our colleagues in the periodontal world really did a lot of work to advance the care of patients with periodontal disease. But sometimes it is so advanced that it doesn't make sense anymore. And that's where the hard decision that you have to make with your dentist on when to keep those teeth or when you go ahead and clean the house in a way and start fresh. The same thing is what happens to teeth trauma. If the fracture of the tooth is beyond restorability, and here is the key element, restorability. If the tooth is restored, we'll do whatever it can to save it. But if the fracture is beyond repair and you have to do so much like root canals and core buildups and cast post and core and a crown, for all that work to last for a year or two and end up being in the same spot year or two later and spending all that money and all that go down the drain, it's probably a good idea to say, okay, enough is enough, say goodbye to that root, and then move on to the next level. When you have advanced wear due to grinding, again, the key element is restorability. Will a restoration be predictable and can be placed on these teeth that will provide long-term result? That is the key, restorability and long-term result. If it's not, then it's probably better off taking the teeth out and consider implants or any other restorative options. In rare occasion, you have a resorption of the tooth, and that resorptions can be external, or which means that the resorptions start from the outside in, or internal, which start from the inside out. Either way, if you are unfortunate to have one of them, most of the time the tooth needs to be removed, and no matter what we do, try to save it, we'll end up in the same spot. And the sooner that we get on the extraction wagon, the better treatment options we have to restore these teeth. So if we look into the most advanced cases, and we'll show you some of the before and after, even though that we have to consider extractions, the treatment options, at least the one in my hand, is very predictable and can result in a very good outcomes. So let's say if you have to take all the teeth out due to advanced cavities, and we can go ahead and put root canals and crowns and post-and-core on each one of them, and we decide to go ahead and take the teeth out, we can easily put a few implants in and provide the patients with a fixed, non-removable bridge that will restore function and aesthetic and go on with life like nothing happened. The same things with advanced periodontal disease. We'll take the teeth out if we have to, whether it's 1, 2, all of them, and we're able to provide a very solid treatment outcome. When the wear is so advanced that to save these teeth, you're going to require doing crown lengthening, which is increase the length of the teeth. It's an advanced surgery that requires a lot of bone removal, and end up putting crowns on some of these teeth, or all of them, that end up putting crowns on very short teeth. Those crowns have very limited long life, and it's better off starting with taking these teeth out and then putting some implants and then go on with life. Trauma, if the tooth is broken beyond repair, remember, it's all about the restorability. If putting a crown on this tooth is shaky and it's not going to provide long-term, we'll take that tooth out and put an implant in. If you have external or internal resorptions, whether it's on one tooth or multiple teeth, we can predictably take some of these teeth out, put implants in, and restore function with implant and implant crowns almost immediately. And if the root canal failed and it started to get infected, the sooner that we get that tooth out and try to save the bone, that will reduce the amount of work that you need, multiple surgeries and bone grafting that you require. So the sooner that we can get that failed root canal out of the way, the faster it is to get you on the recovery route. So extraction is emotional and hard decisions to make, but it can be the right decision when it is an advanced cases. Remember, each case is individually treatment plan, and each one is unique. So please, if you have any question, do not hesitate to contact us and ask for a complimentary consultation. Please hit the like button and don't forget to subscribe to the channel.